What's diabetes? It's a very commonly used word. We have a large number of population suffering from diabetes. But I don't think so. We still in a country are aware what exactly diabetes is all about. Because we think diabetes is blood sugar, and you're absolutely wrong in predicting that. Because diabetes is not just the blood sugar. The blood sugar goes up high, it's not as dangerous as if it's not associated with other problems. So people just think that checking blood sugars is good enough and just go get it with diabetes. And they think just stopping a couple of things like stop eating sugar, stop eating chiku, stop eating banana. That's an absolutely wrong statement. That diabetes is high sugar, stop eating things and you're sorted. So one of the biggest myths this country is suffering from, that diabetes is sugar. It's beyond sugar. That's very important for everybody to understand that. If you don't treat diabetes on beyond sugar and we do not manage it properly, then we would not know what's the problem. If you don't know the problem, you will not know the solution. So diabetes really can affect different parts of the organs, and it is associated with several disease groups, hypertension, high cholesterol, and that leads to different complications, which include stroke, heart attacks, eye disease, kidney disease, erection difficulties, nerve disease, fatty liver, and so many other disease processes. You're more prone to have infections, you're more prone to have diabetic foot ulcers, you're more prone to have amputations. So it's very important to understand that diabetes leads to several complications, and that's what diabetes is all about. And we need to understand several tests before we go in for diabetes assessment, which we'll talk in. So what happens in diabetes is that you have a pancreas, which is heading behind the stomach, has got different type of cells and called alpha, beta, and gamma cells. Beta cells is the one which produces insulin, and the beta cell productions of insulin goes down, and that's why the blood sugar tends to go up high. When there's not sufficient insulin in the system, that what's happening, that glucose is not put inside the cell, because the role of insulin is to catch glucose, put inside the cell. Otherwise, if there's not sufficient insulin, there's a high blood sugars floating around, and that tends to damage blood vessels. So it's like a mechanism where the glucose goes inside, and the insulin is like a key mechanism. So until there is no insulin available, the glucose won't go inside. To talk about why diabetes and what's the relation of weight and exercise and insulin level, and why people who are overweight tend to have more diabetes. Definitely you need to have family history, lack of exercise, overweight. That's one of the main criteria for having a diabetes. So what happens naturally, that body insulin levels, as discussed before, is the one which pushes the sugar into the cell. And when overweight happens, obesity happens, and lack of exercise, insulin effectiveness, we call it insulin resistance in different words, means amount of insulin required to do a same job is more than usual. So the insulin resistance starts going up gradually once the weight starts going up. So a point comes that insulin starts carrying going up. Body is able to start producing insulin more than usual. So the normal production should be like this, but this starts going up higher, higher and higher. But a point tips over where the insulin production starts going down. So this is a point where the body insulin resistance, because of lack of exercise and obesity, insulin production is able to match a point where the blood sugar to an extent is normal. So this is blood sugar, this is almost normal, but a point comes when the insulin production starts going down. Insulin resistance is same because the body weight has gone up and there's a lack of exercise, and the blood sugar starts going up. So this is what the turning on of diabetes. So a lot of people ask me what's my insulin level and what's the relation of blood sugars with it. I don't think so any test would really define your state of insulin levels. It's better really more go on just glucose testing. And most people with type 2 diabetes or overweight may have little higher insulin level at early stage, and they would tend to go down. When the insulin production goes down and the gap of insulin resistance and insulin productions, the blood sugar starts going up. And as I have discussed earlier as well,